So the interesting part about this is that it's a tibial shaft, but it's a very, very distal tibial shaft, right? So you measured it in the CT scan to have like 6 millimeters from the actual joint. So as a tibial shaft fracture, it will be amenable to intramedullary nailing, which is the standard of care, but we're not doing that for two reasons. First of all, the fracture is very distal, so you may not grab enough of the distal piece of the tibia to actually be able to secure the stability. But most importantly, this scar represents a total knee replacement. So the angle, the entry position for the IM nail is going to be very hard. Her tibia actually has a very little space. Occasionally, we have done intramedullary nails around tibial prosthetics, but it's usually when the prosthetic lies a little bit posterior and you have a safe spot to put the nail somewhat more anteriorly. The risk with that is that if you're putting your nail too anteriorly to avoid the knee, you can damage the tubercle. And if you get a tubercle fracture, that's like a big problem, right? That's almost a worse problem than what we're trying to solve. So for her, we're going to do a more traditional medial plating, you know, and there's two approaches to it. You can actually just open it up and take a look, clamp it, and put a screw across it, and then put a plate that's called a neutralization plate. Neutralization because it neutralizes the forces acting on the screw that you put initially across the fracture plane, which is what does your fracture. Sometimes, if you can reduce it beautifully, you could potentially do a percutaneous technique, which is a little bit safer on the skin, but the important thing here is to make sure you get the reduction done adequately. So once you start by bringing the serum on and mark the margins of the fracture.